from Agarwal Hospital here at 4 o'clock, where we will be trying to show various techniques including iris repair of pinhole surgery as we call it. That means if someone needs an eye transplantation, we can avoid it by simply making the eye like a pinhole so the person sees. Globally, ladies and gentlemen, in the world, there are about 60 million, that means 6 crore people blind waiting for donor corneas. Imagine the magnitude of the problem, and every year this number will increase. So with the pinhole surgery, the dependency on donor corneas will come down drastically, because also not only donor corneas coming down, also as the procedure is comparatively easy and safer compared to a full keratoplasty, perhaps it will pick up much easier and faster by a normal surgeon. I'd like to thank each of you for coming for this conference. Thank you very much.
It has crossed boundaries and it has been able to bring the international ophthalmology to India, as with the IFFA or the ACRS that is going to be held in India this year. We also take a great pride that we are the largest body of life member society of ophthalmologists, 28,000 in the world. That's the largest in the world. And we speak volumes because with India is such a great country, such a huge country, it's actually a subcontinent. And ophthalmology, how we practice, the problems of ophthalmology, as well as the solutions to ophthalmology that we give in India is something that can be emulated anywhere and everywhere in the world. This year, as a presidential project, we have undertaken eye screening for school-going children for the coverage of refractive errors as well as assessment of the refractive errors. And this is specifically because we know that myopia is going to become a pandemic, if it is not already there. Nearly 50% of the Asia-Pacific individuals are going to be myopic by 2050. And this is a very big challenge to us. We have taken up this challenge and we need to tell our policymakers, our government, what is to be done so that the pandemic of myopia can be curbed. And within a year, we will have our reports ready and we will be able to tell not only the Indian government, but also everywhere to the world that this is how we should do to curb myopia and the pandemic thereof. I thank all of you, I thank the delegates, I thank the chief guest who has been so gracious to come to India. I thank the guests of honor, and I thank every one of you to be a part of this wonderful gathering of IIRSI. Thank you very much.
You see so many people, so they can see all the trade. Now they are manufacturing you can say the tears more than the antibiotics, and that is because of the mobile. So we all should come forward and do something for this mobile use. Otherwise, I think we will develop the dry eye since the birth of the child. Thank you, Amar. Thank you very much.
I wondered why she was asked to be here. I have no such doubt. The Chief Minister asked me to step in because he was not able to make it due to other commitments. So I'm here, of course, on his directive. But I'm also here because I'm very happy to participate for a few reasons. The first being that, as the Chief Minister says, education and health are his two eyes, and that's what he uses as the analogy, eyes. So in that sense, I'm thrilled to be at an event that imparts education about the health of eyes and about the correction of eyes, and is a pioneering event. It's now running for many years in Tamil Nadu. For those of you who are not that familiar, you may know Tamil Nadu is a pioneer in many aspects, in education, in medicine, in ophthalmology, and it is now increasingly a center for medical tourism, drawing people not just to Chennai, but to Madurai, Tirunelveli, Coimbatore, Salem, Trichy, etc. We have the highest number of government medical colleges and the highest number of government medical seats and beds, And part of that, of course, is the specialization that you all are very prominently representing here. Our focus on the eye goes back in government policy for decades. When our previous Chief Minister, our party leader, Talavar Kalaignar, was in office, we introduced a Thittam called Kannuli Thittam, which was a mass campaign to reach over 700,000 people and provide cataract surgeries, vision correction and awareness. It continued, actually that was 1972, then in 2009 we expanded it to school children, and now under our Chief Minister we have expanded it even further and taken a very comprehensive approach, including universal screening of newborns, check for retinopathy in prematurity and preterm children, and then of course many other advantages. Today Tamil Nadu is a pioneer for many reasons. On the government side we have done a lot of things. Private enterprises like Dr. Agarwal and his many initiatives have had a big impact. My own friends in Madurai of the Arvind Eye Hospital Group have done a lot of pioneering work and are using AI, partnered with Google to do a lot of detection and prediction. And about 6 months ago I was at the Shankar Netralaya annual awards, so I know we have a sure feet of wonderful institutions in this space. My own personal career, when I was Senior Managing Director at a global bank, our charity, which we put the bulk of our money in, was called Seeing is Believing. It was Standard Chartered Bank, and we did this around the world. And so I came as a believer in the value of providing early and relatively low-cost intervention and support. As an opposition member of the Legislative Assembly, we started running camps in Madurai, where we have provided tens of people with access to the government cataract surgeries they otherwise entitled to, but simply couldn't reach, and hundreds of individuals with spectacles. So with all this as the background, though I was sent here by diktat, I still say I'm very happy to be here and see many aspects of this conference. Continuous learning is so important in all professions, and this notion of live surgeries, wet labs, and telecasting of things going on, I think is a tremendous opportunity for you to learn. I'm also very happy to see that this is an international conference in every way, and just I'm reminded of my 20 years as an expatriate in the US, of my 30-year expatriate career and all the places I've been as a banker, including San Francisco, LA, Boston, of course, New York, where I worked, Minnesota. So I'm happy to see it's a very international conference. I'm also going to commend the organizers for using this occasion to give these international and Indian awards and honor the pioneers and the exemplary practitioners of your profession. For all of us, recognition from our peers is highly valued and much greater than the normal kind of social award. So I think it's a tremendous idea. I hope you continue it. I congratulate all the winners. I thank all of you, as did Aarti, for all of the work you do. I hope you have a wonderful convention. I hope you have a wonderful time in Chennai, and I hope you come back every year and give us the pleasure of your company. Thank you very much.
Precious thing in the world is, and perhaps is a world itself. And how do we come to know and appreciate this world? Through the gift of vision. The vibrant colors of our natural landscapes, the joyful expressions of our children, the written word that empowers minds, all of these experiences are made possible by sight. It is through our eyes that we understand, connect with, and shape the world around us. Today we gather not only to celebrate this miraculous gift, but also to reaffirm our collective responsibility to protect it, restore it, and where it has been lost, and make quality eye care a reality for everyone, regardless of geography, income, or circumstance. As Minister of Health and Wellness in Mauritius, it is both an honor and responsibility to share with you the progress we are making in the field of ophthalmology and the vision we are shaping for the future of eye care in our country. Mauritius is proudly considered a welfare state, and healthcare is entirely free in public institutions for all Mauritian citizens and residents. This includes access to primary, secondary, and specialized medical services delivered through a well-structured network of facilities across our island. Care is provided without charge in public hospitals and clinics, ensuring that no one is denied treatment due to financial hardship. The healthcare infrastructure comprises 5 major regional hospitals, which are supported by tertiary care institutions, as well as wide-reaching network of mediclinics, area health centers, and community health centers that deliver care closer to where people live. This integrated system forms a foundation of our public health delivery model, including ophthalmic services. Ophthalmology is a vital component of this system. In Mauritius, thousands of citizens depend on timely and quality eye care for their daily functioning, independence, and dignity. Sight-saving treatment is not a luxury. It is a necessity that directly affects education outcomes, workplace productivity, and overall quality of life. Currently, the delivery of ophthalmology services is anchored in 3 major hospitals, with the Subramaniam Bharati Eye Hospital serving as a national center of excellence. This facility is the backbone of our public eye care service, offering a broad range of services from routine cataract surgeries, one of the most common and treatable causes of blindness, to advanced surgical procedures such as vitrectomies for retinal disorders, corneal grafts for patients with irreversible corneal damage, squint, as well as oculoplastic surgeries. These complex surgeries are made possible in part by collaboration with foreign specialist teams, notably from India, Switzerland, and France, who regularly visit our facilities under structured partnerships. Their expertise not only fills current gaps in subspecialties, but also contributes to ongoing knowledge transfer and training for our local medical personnel. In parallel, we are reinforcing eye care at the primary care level through school health programs. Screening for refractive errors is conducted systematically to ensure that children receive early intervention and necessary corrective measures such as prescription glasses. Additionally, retinal screening for diabetic retinopathy has been integrated into routine diabetes care, allowing for early detection and management of this sight-threatening condition. Moreover, in collaboration with the Ministry of Social Security, low vision patients are supported through access to spectacles at reduced cost, a vital initiative ensuring affordability and equity in vision care, especially for vulnerable population. While we have made commendable strides in building local capacity, there remains critical gaps in subspecialized ophthalmic care. For such cases, in-country treatment is currently not viable. To ensure no patient is left without the care they need, we rely on our overseas treatment scheme, a policy initiative that allows for referral of complex medical cases abroad with financial and logistical support provided by the ministry. This system is underpinned by formal memorandum of understanding with network of prestigious medical institutions in India, like Agarwal Medical Institute, some of which serve as referral centers for our most complex ophthalmic cases. Our approach, however, is not only reactive. We are investing steadily in building long-term sustainable local capacity that includes strengthening local surgical infrastructure with modern diagnostic and operating equipment, expanding public-private partnership to enhance efficiency and expertise, upskilling local ophthalmologists through hands-on training with visiting specialists and attachment abroad, and developing subspecialty units within the country to reduce dependency on overseas referrals. We also recognize the importance of regional integration. Mauritius, with its universal healthcare system, stable governance and strong health infrastructure, is well positioned to serve as a regional hub for specialized medical services, including ophthalmology. We aim to expand our services not only for our population, but as a trusted referral point for patients across the Indian Ocean and parts of Africa. In that spirit, I would like to extend a warm and sincere invitation to the Intraocular Implant and Refractive Society of India and its esteemed members. Consider Mauritius not only as a destination for medical outreach, but as a committed partner in training, research and service development. I would like to take this opportunity to commend the organization of this consultation and all experts gathered here today. Your work goes far beyond clinics and laboratories. You are restoring not just vision, but hope, mobility, and human potential. I would fail in my duty if I don't bow before India for the support that Indian government and Indian institutions have rendered to our country in the field of medicines. As I have just mentioned, that whenever we have got difficult cases in Mauritius, those patients are sent to India, and especially in the southern part of India, in Chennai, where we get the best type of treatment. I would like to thank Dr. Agarwal, who is here, for the immense great work that he is doing in our country in the field of eye surgery. And I would like to, again to thank him on my behalf, on behalf of the government of Mauritius, because in fact we have learned, we have got a lot from India. Whenever all other doors are closed, we turn towards India. That's why I say, when we visit other countries, we go there as tourists, but when we come to India, we come here as pilgrims to learn and to gather and to acquire. Thank you.
Thank you very much, sir, for your words of encouragement.
So, first of all, Indian Intraocular Implant and Refractive Society இங்க பெரிய கான்ஃபரன்ஸ் நடக்கிறது. இதே 2 நாள் கான்ஃபரன்ஸ் இருக்கு. We have about 4,000 doctors from all over the world here. நம்ம இன்னும் இங்க அட்வான்டேஜ் என்ன இருக்கு? We want to educate and teach eye doctors from all over the world in new techniques. For example, யாருக்கு அடிபட்டுச்சு லென்ஸ் போட முடியல, நம்ம கம் போட்ட உள்ள லென்ஸ் ஃபிக்ஸ் பண்றது, அது நம்ம சொல்றது glued IOL. Another new technique which we are going to show now, live surgery. Actual surgery will show live from Agarwal Hospital directly to the hall will be pinhole surgery madri, in which யாருக்கு front cornea damage இருக்கு, we can avoid eye transplantation and make the eye like a pinhole. The conference inauguration another by Mr. Anil Kumar Bachoo, our Health Minister of Mauritius, and our special guests of honors were Dr. Aarti Ganesh and our Information Technology Minister. Next to me here is Dr. Stephen McLeod, President and CEO of American Academy of Ophthalmology. This AO na solradhu largest body in the world of eye doctors which educates people everywhere. Another thing நம்ம கிட்ட இங்க இருக்கு mainly is to teach doctors from all over the world how to do புது techniques இப்படி பண்ணோம். That is the main aim. I would also like to thank the Tamil Nadu government, our Honorable Chief Minister, Mr. Stalin, for always helping us increase healthcare in India and in Tamil Nadu. Sir, I want to thank you personally for all what you are doing, sir. So, latest technologies inga irukku. நம்ம பக்கத்துல இங்க Dr. Maipal Saxdev from Delhi, Dr. Satanshu Mathur, and leading eye doctor from Chennai, Dr. Mohan Rajan. So all in all, this 2-day conference, now we are going to educate and teach people latest techniques in eye surgery. Thank you very much.